there, Baby Doc here with some sage advice for expectant parents and newborn healthcare professionals about neonatal shock. Neonatal shock is a life-threatening condition where the body isn't getting enough blood flow, oxygen, and nutrients, resulting in poor perfusion, tachy or bradycardia, and possibly low blood pressure. There are 4 main types of shock, which are distributive, hypovolemic, obstructive, and cardiogenic. All neonates with shock requires that airway, breathing, and circulation are immediately supported. Continuous monitoring of vital signs, oxygen saturation, and urine output is crucial. Therefore, hospital admission for further management and monitoring is essential. Additionally, maintaining body temperature is important to avoid worsening the condition. Once these initial steps are taken, intervention and prompt treatment are tailored to the specific type of shock. The first type is distributive shock, which is an abnormal distribution of blood volume, often due to vasodilation. Common causes in neonates include sepsis, most common, anaphylaxis, and even severe burns. Specific neonatal interventions are immediate antibiotics for suspected sepsis. Fluid resuscitation with aggressive intravenous fluids such as normal saline to increase blood volume and administration of vasopressors like dopamine may be needed if hypotension persists, with doses starting at 10 micrograms per kilogram per minute, and titrating potentially as high as 30 micrograms per kilogram per minute. In addition, it is important to treat the underlying cause. For example, anaphylaxis would include epinephrine and antihistamines. The second type is hypovolemic shock, which is a decrease in intravascular volume due to fluid loss. Common causes in neonates include hemorrhage, fetal or neonatal, and dehydration from diarrhea or vomiting. The primary treatment neonatal intervention is aggressive intravenous fluid resuscitation with normal saline and blood products. In fact, early administration of blood products is crucial if blood loss is the cause. If a hemorrhage is ongoing, measures must be taken to control the bleeding. The next is obstructive shock, which is an obstruction that impedes the heart's ability to pump blood effectively. Common causes in neonates include cardiac tamponade, tension pneumothorax, or compression or blockage of major blood vessels. Specific neonatal interventions are aimed at relieving the obstruction. For example, a tension pneumothorax requires immediate needle decompression, where cardiac tamponade must have pericardial centesis performed to remove the pericardial fluid. Finally, vasopressors may be needed to maintain blood pressure while treating the underlying problem. The final type is cardiogenic shock, which is primary pump failure of the heart. Common causes in neonates include congenital heart defects, myocardial infarction, or severe arrhythmias such as V fibrillation or pulseless B-tap or PEA. With cardiogenic shock, administration of intravenous fluids are used with caution, as they can worsen fluid overload. Medications like dopamine can be used to improve cardiac contractility, and vasodilators are added to decrease afterload and improve cardiac output. Correcting congenital heart defects or managing arrhythmias is critical. Be sure to like and subscribe to McGlinn Institute Neonatal, and join me, Baby Doc, for more sage advice.